My name is Jill Goodwin. I'm General Manager of Community Services. Through this video, myself and some colleagues are going to tell you about the Change programme. Many staff have already contributed to our plans to change health and social care in the long term for Mid-Nottinghamshire. We all have a role to play in delivering the best possible care for patients.
The issues with our services are they're continually stretched, our patients are becoming more complex and our community is much bigger. The impact on patients is that despite all our best efforts, they don't always get the best care. Patients find it difficult to navigate through the health and social care system, and they say we don't communicate well enough with each other and sometimes not with themselves. Better Together will be a plan of how we're going to deliver health and social care services, putting the patient at the heart of these services and not the organisation. The challenge will be delivering this at a time of financial austerity with a growing funding gap across the region.
We are having conversations with staff and the public about how the new services might be formed so that they meet patient needs. This will be completed by the end of the year, and it will take a year to plan and prepare for change.
We'd like you to think about and answer these simple questions. How can we keep patients' time in hospital to a minimum? How can we make sure people are referred to the best service for them? How do we do this close to home? How do we help patients to choose the best care option for themselves?
Your feedback will be critical in determining the final proposals. For patients with complex health needs, we want to proactively manage their ongoing care via a range of tailored services available 24/7.
By planning integrated care around people with complex needs, we will improve their independence and quality of life. We also want to see improvements to their carers' lives by supporting the patient to lead as full a life as possible.
Our aim is to use teams of specialists who will then work together in order to provide care and support to patients and their carers. The benefits to the patient would be that they'd have a named person who would coordinate and oversee their care and a personalised care plan that would be individual to them. The specialists will be based in a place that's convenient to the patient, and they'll also have a self-care hub where a trained advisor will be available to provide advice and support to patients and their carers.
We want to make it easier for patients to access urgent and emergency care.
We want to improve urgent care by simplifying things with primary care, secondary care and social services working together for better access to primary care and other services out of hours. We want to simplify access by having a single front door at Kingsmill Hospital where with one attendant you'll either see primary or secondary care. We want to create a clinical navigation hub that healthcare professionals can access to allow access to all the services that are available with one call alone. We want to improve access to GP services, both same-day appointments and out-of-hours appointments. We want to allow paramedics to treat people in their own home and to strengthen their decision-making to keep patients at home and avoid admission. And finally, we want a rapid access response team to allow patients to be treated in their own home or to allow carers to be put in to avoid admissions.
We want to ensure that patients receive the best pathway when accessing health and social care services.
The aim is to use service user feedback to determine where and how services can be better provided in the future. Where needed, we'd like to co-design, redesign and update pathways in 10 specific areas.
We want to provide more reassurance and support to parents and children and keep hospital time to a minimum.
We would like to create a short-stay paediatric assessment unit at Kingsmill Hospital next door to the children's ward. This will be where sick children and babies could be assessed quickly by a senior paediatrician and treated appropriately. It would allow us to observe them for a few hours and they would only be admitted actually onto the ward if absolutely necessary. This has to be of benefit to the children and also reassuring for their parents. We also feel there is a need to create better integrated care for those children with long-term conditions and complex needs within the community.
Colleagues are represented on each of the workstream teams within the programme, and they will be looking at what needs to change and how this will be delivered. This will ensure that if the organisation or team you work in will be changing, you will be well informed about what will change, when it will change and the immediate impact on you, your working practices and your colleagues.
To find out more about the programme and likely implications, we have also prepared a presentation for staff, and there is a programme website which you can look at. Also, look out for updates on staff intranets and newsletters. Thank you for watching.